In this video, I'm going to be talking about 4 things that can cause eye bulging, also known as proptosis. So there's different things that can cause the eyes to bulge out or that can cause them to regress, but we're going to be focusing on what causes the eyes to bulge out and kind of have that bug-eye looking appearance. So the first and most common thing that I typically run into for things that can cause eye bulging have to do either with an overactive thyroid or an underactive thyroid. Meaning if there's too much thyroid hormone being made or too little of thyroid hormone being made, this can be known as hyperthyroidism or hypothyroidism. There are also conditions associated with an overactive or underactive thyroid that can include Graves' syndrome, Hashimoto's syndrome, different things that if there's too much thyroid hormone being made can cause the eyes to bulge out, swell the muscles, and create that bug-eyed looking appearance, which can also lead to dryness and pain and inflammation and different things that go on with the eyes to make them not feel good, as well as you not seeing good. Now, an underactive thyroid can also have the same problem because the eyes can also bulge out if there's not enough thyroid hormone, meaning that you need to have the right amount of thyroid hormone, not too much, not too little, just somewhere in the middle, in order to make sure that your eyes can healthily function, see, and move the eye muscles accordingly to send signals from the brain to those eye muscles to have the eyes move and track and see and interpret vision to send it on to the brain. This can also be categorized as thyroid eye disease. You may have seen a lot of commercials for this. There are certain prescriptions and injections and steroids and different things that can be done to help kind of calm down any inflammation or bulging or eye issues that are going on related to an overactive or underactive thyroid to help the eyes kind of regress and go back into where they need to be at a normal standpoint for someone's normal eye anatomy. Something else that can cause eye bulging can be an eye infection. Whether the infection is behind the eye, in the middle of the eye, in the front of the eye, can cause it to kind of protrude out just a little bit more. Whether the lids are swollen or the eye muscles are swollen or there's something else going on behind the eye causing an infection to push outward just a little bit, that can cause an eye to bulge as well too. An injury to the eye can also cause an eye bulging situation as well too. So if you get punched in the face or have a black eye or anything like that, the swelling and amount of blood and edema and different things that cause the eyes to bulge out can also force it to bulge out as well too. Cancerous tumors and among other tumors can also cause eyes to bulge out as well. So if there's an overproduction and uncontrolled growth of cells and reproduction of those cells, that can cause an eye to bulge out as well. You can also see this stuff sometimes on CTs, MRIs, and different things even before the eye bulges out. So if there's any weird or unusual symptoms you're experiencing, like double vision or headaches or anything unusual like that, make sure to contact your local optometrist or ophthalmologist to get a look at your eyes to make sure that things are normal and where they need to be, or if they're not, then they can order the right testing and do the right examination to determine what's going to help you get your eyes and the bulging situation under control. Glaucoma can be another thing that can cause the eyes to bulge. Not really a very highly talked about association. You don't really think about glaucoma and eye bulging being associated with one another, but they can be, especially if someone has had glaucoma from birth where the eye just swelled up too much and can just protrude and push out and cause vision decline and pain and all types of issues. And another condition out there is called orbital pseudotumor, meaning like there is an idiopathic inflammation. And when we say idiopathic, it means that we don't know what's causing it, but there is a massive amount of inflammation that's pushing on the muscles in the eyes to cause it to bulge out and have that bug-eyed looking appearance. But if you like this video, give it a thumbs up, subscribe, and tap the bell for more notifications and to stay up to date on learning more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.